conducted by Lancet Journal on excess deaths on the African continent due to COVID-19 paints a rather bleak picture. It shows that there have been more deaths following COVID-19 critical care admission in Africa compared with the global average. It also finds that the mortality of critically ill COVID-19 patients in Africa exceeded that of any other region in the world. The study was conducted in over 3,000 critical care COVID-19 patients from 64 hospitals in 10 African countries. For more on this, I'm joined by Professor Bruce Biccard, Deputy Head of the Anesthesiology Department at the University of Cape Town. Professor, good to have you with us this afternoon. And perhaps let's try and put this into perspective, because when we're talking about the number of deaths, earlier on when COVID-19 started, the WHO as well as other international bodies were very worried about the African continent, and they predicted that there literally would be a wipeout of many on the continent. But the reality has proven itself different. Talk to us about the focus of this particular study and how the two concepts, what the study focused on and what was initially thought, how those perhaps merge, or if there is a point of convergence for them.
Thanks very much. So thanks for this opportunity. I think you're right. This study actually started in March last year when we saw what happened in Wuhan and in Italy. We were concerned because we knew we had limited resources, limited workforce, and there was no data on how to manage this problem in critically ill COVID patients. And so we started this study to inform decisions on looking for factors associated with mortality and survival. And I think your point is that we expected the case rate to be really high and patients do really badly. And what we've seen is it's been slightly different. This study, though, focuses on critically ill COVID-19 patients. And what we see in that group of patients that they do terribly. So you spoke about the excess deaths. So for every 100 admissions to critical care, between 11 and 23 more people will die in Africa than the global average. So the numbers are terrible. 1 in 2 patients who's critically ill with COVID dies in Africa.
So does this research and the outcomes of the research mean that more people on the African continent died than was necessary? That if the requisite equipment was there, that these are lives that could have been saved? Absolutely.
So we've termed this excess deaths for that very reason. We do believe that excess deaths, which are unnecessary deaths, they're driven, we think, predominantly by lack of resources. And what we've published here, we think, is an optimistic picture of what's happening. I'll tell you why. The first is, of all the patients who referred to critical care in Africa in the study, only 1 out of every 2 actually gets into critical care. So half of the patients, we don't know what happened to them, but I suspect many of them have a very bad outcome. And then what we see is that once they get into critical care, there's excess deaths, and it's driven by the inability to provide therapies that they should get. So we estimated that the therapies that are needed for the severity of the disease, they're getting 7 to 14-fold less than they should.
So talk to us, Professor, about these therapies, about the equipment that is in shortage on the continent. And could one use a blanket statement, or did the type of equipment that was in shortage vary according to which country you were actually looking at?
So the findings, I think, are basically generalizable. It was across a wide range of hospitals and countries. So we didn't see any country or hospital stand out in particular, but the therapies that were unavailable or available in a short supply were things like dialysis, which patients might need, or in these critically ill COVID patients, often they turned onto their tummies, which helps with the oxygenation when they're ventilated. And to be able to do that was extremely difficult as well. But what was really scary was that basic monitoring that people would consider standard in all critical cares, like measuring the saturation of the oxygen in the blood with a little probe you put on your finger, wasn't available to all the patients. So if you can't monitor the patients appropriately, it means you miss out or you determine deterioration late. So you can intervene late. You can't see the efficacy of your treatment. So it's monitoring and therapy equipment, which is in short supply.
So what then is the way forward as far as healthcare on the African continent? Because I would assume that COVID-19, and you'll correct me on this if I'm wrong, that COVID-19 just exacerbated or brought to the fore a pre-existing issue of being ill-equipped and a shortage of the necessary therapies and care.
Absolutely, you're absolutely correct. So for me, I think there are three things. The one is Africa is in a vulnerable position with COVID-19. So we've got an unvaccinated population and we've got critical care resources which we know are limited. So the first thing is we have to try and get the continent rapidly vaccinated because we're not going to increase the resources for critical care now quickly. So vaccination is number one. Patients who are vaccinated are less likely to have severe disease. Number two is in our study we saw steroids are protective, which had been shown before, and we also know oxygen is protective. So we have to get steroids and oxygen to all sites which provide critical care for COVID patients. And then the third thing is what you're talking about is we've exposed something which already existed, a lack of critical care resources. What we really need for Africa is we need standards which are considered an absolute minimum to provide critical care, and that should be regulated, and it allows us then to ensure that sites meet those standards and people can be held accountable if you cannot provide that level of care in a critical care environment. That's a longer term issue.
And are there bodies within the health fraternity that would be responsible for the perhaps standardization as much as one possibly can of healthcare, specifically on the African continent?
Yes, absolutely. I think, well, governments certainly have to play a part in this. So there are, as part of health plans for governments, they need to have critical care standards which are set, and often they can be jointly delivered or prepared with critical care societies. So this study was funded by the Critical Care Society of Southern Africa, and they would be able to provide very good leadership in that space and what minimum requirements are.
All right, we'll leave it at that for this afternoon. Professor, thank you very much for that update. That's Professor Bruce Biccard, Deputy Head of Anesthesiology at the University of Cape Town.